What if I told you pain was not your enemy, but it was your alarm system? Today, we're going to learn how to listen to it so that it doesn't continue going off. Has anyone ever explained to you what pain is or how pain works? My name is Oliveira, and I'm a doctor of physical therapy and a therapeutic pain specialist. I treat people with pain and I teach them how to treat their pain. Pain is our alarm system. It works like other alarm systems. For example, a fire alarm in your building, if someone were to pull that fire alarm, it goes off and tells you that there's a problem. It doesn't tell you how big the problem is or exactly where. It just tells you that there's a problem. Get out of the building. When we hear a fire alarm go off, we don't stick around to try to figure it out. We do exactly what the alarm is telling us to do. We go get help. And in that scenario, it's leave the building so that we're safe. Alarms protect us from danger or potential danger. And they do that by alerting us to a problem. Our alarm system is complex. Our nervous system is divided into two sections. You have the central nervous system, which is your spinal cord and your brain, and then you have your peripheral nervous system, which is all the nerves that are out in the body. The peripheral nerves are like a lookout on the ship. Their job is to take in information about the environment and report that information up to the brain for decision. When those lookouts find something that is dangerous or may appear dangerous, they get on the phone of the ship and they call the bridge where the captain is and they tell the captain about the potential danger. The captain, or your brain, then gets to decide how big of a threat this danger is and what to do about it. If the captain determines that there's a big threat and action needs to be taken now, it turns on the alarm system, alerting the whole ship to the danger. Other commands will follow, like slow down the ship or turn the ship. Another example is when you put your hand on a hot stove. Initially, you may feel the heat, but you don't pull your hand away until the alarm system is triggered. And that's because the brain has decided that the stove is too hot to keep your hand there. So just as you pull your hand away, the pain starts. Once the hand is safely away from the hot stove, pain that is there will start to go down. It'll go down slowly and eventually go away because our nervous system wants to make sure that we're still safe. So it doesn't just turn it on and then turn it off. It turns it on suddenly and then it slowly goes down. Our nervous system is designed to protect us, and it does that by keeping us aware of dangers. So when we encounter danger, our system revs up, and then there's a period of time where we need to wait for the system to calm down before the alarm system is fully turned off. The lookouts will stay alert until the threat is completely gone and they feel confident that the threat is completely gone. Then the state of alarm will finally get shut down by the captain. Our alarm system has over 400 nerves in it that span about 45 miles in the human body. Imagine each of those 400 nerves as a lookout who are looking out for you to keep you safe. It can take some time for the nervous system to calm down, and sometimes we have to actively do something to help that process along. That could be doing meditation or deep breathing. Exercise is another good option. You can use different types of therapy, like ice therapy or heat therapy, massage therapy. These are all good choices. They help you in the short term to help calm down your system. Now that we know what pain is and roughly how it works, what can we do about it to reduce our pain? We want to calm the nervous system. This really just depends on what type of pain that you are experiencing. There are 3 different types of pain that I'll be making another video on to describe in detail. Thank you for watching to the end, and if you found value in this content, then hit subscribe and like, and stay tuned for more.